Ever catch yourself wondering what the ER of the future might actually look like?
Yeah.
Well, today we're diving deep into Bluebird. It's a super advanced electronic health record system, but specifically for emergency rooms.
Oh, interesting.
Yeah, we're going to be looking at Bluebird Hospital EHR, ER.PDF,
Okay.
to see how this tech is totally changing the game in emergency medicine. So picture this. You walk into this crazy busy ER, right?
Yeah.
Every single second matters.
Right.
Now imagine a central hub, think air traffic control, but for patients.
Okay.
It gives doctors and nurses a real-time view of every patient, their condition, where they are, even how long they've been waiting. And that's one of the big things with Bluebird. It's called the ward whiteboard. It's all about bringing order to what can be, honestly, kind of chaotic.
Yeah, you're telling me.
Yeah.
Traditional ERs, they're often swamped, overcrowding. Things get lost in translation, and the pressure's always on, so mistakes can happen.
Oh, absolutely.
What's really cool about Bluebird is how it tackles these things head on.
Okay.
Like that ward whiteboard you mentioned, everyone's on the same page because everyone sees the patient flow.
Right, and it's not just about seeing the information, it's about having the right information when it matters.
Yes, you got it.
Yeah.
Bluebird also bakes in standardized protocols and order sets for different conditions.
Oh, interesting.
So let's say someone comes in with, say, a suspected heart attack. Bluebird has those latest cardiology guidelines integrated, right?
Yeah.
It can actually prompt doctors to follow the specific treatment protocol.
Right.
So no matter who's on duty, that patient's getting the most up-to-date care.
So it's about less variation and more consistency.
Exactly. Crucial in emergency medicine.
Absolutely.
Now, on to another critical thing in the ER triage.
Oh, yeah.
We've all been there, right?
Totally.
Waiting, wondering how bad it is, a little anxious.
The worst.
Bluebird uses something called the South African Triage Scale SATs, for short, to assess a patient's condition when they arrive. It's all about speed and accuracy.
And for those who don't know, SATs is like a decision tree, helps nurses prioritize the most urgent cases super fast using colors.
Colors?
Yeah, so red is critical, orange is very urgent, yellow is urgent, and green's more routine.
Makes sense.
That way, the most pressing cases are seen first.
And this is where Bluebird's tech really shines. Those initial moments, accuracy and speed are everything. And Bluebird helps apply SATs consistently, so you're less likely to have errors, especially in the heat of the moment.
Like a safety net.
Exactly.
So the most critical cases get attention right away.
You got it. And Bluebird doesn't stop at triage. Nurses also get specialized tools to do their jobs even better.
Oh, how so?
Well, they've got these pre-arrival care forms, so they can document any treatment given on the way to the hospital.
Oh, smart.
Then they can move on to more thorough assessments, like the primary and secondary surveys.
Now, I know we just threw out some medical terms there. For anyone listening who's not familiar, a primary survey is that really quick head-to-toe assessment.
Yeah, to catch any life-threatening injuries.
Exactly.
And these assessments are way more than a simple checklist.
Okay.
They're structured to make sure all the data is collected so nothing major gets missed.
Got it.
And then all that detailed info is readily available to every healthcare provider working with that patient.
So Bluebird ensures continuity of care, like a digital thread connecting everything.
And here's where it gets cool.
Yeah.
These standardized assessments within Bluebird, they become a common language for all the healthcare providers involved.
Interesting.
Which is so key in the ER. Clear communication can be the difference maker.
For sure. Speaking of communication, let's talk about ER doctors. How does Bluebird support their decision-making?
So many ways. It helps with diagnosis, planning out treatment, and patient disposition.
Patient disposition.
Yeah, so deciding if a patient needs to be admitted, maybe to a specific ward, transferred somewhere else, or if they can head home and recover there.
Makes sense. What's amazing is that Bluebird's not just recording, it's actively helping doctors make those decisions with more information.
You got it. Take pneumonia, for example. Bluebird uses these scoring systems, like the CURB-65 score.
The what? Sorry, the CURB-65.
Yeah, it helps assess how severe the pneumonia is.
Interesting. Can you break that down a bit? What goes into that score?
Sure. It looks at things like age, blood pressure, even mental clarity.
Oh, wow.
And it helps determine if someone needs to be hospitalized or can recover safely at home.
So it's all about using data to figure out the best course of action.
Absolutely, the best outcome for each patient. And Bluebird also has this clinical decision support integrated, so doctors have those evidence-based guidelines and recommendations all right there.
It's like having a medical library on hand at all times. This integration of data and technology is incredible. But how does Bluebird handle the bigger picture? Like the overall flow of patients and making sure resources are used well?
That's where Bluebird's data collection and reporting come in. It's gathering information at every point of a patient's journey through the ER.
Okay.
And all that data, it's not just sitting there. It's being used in some really amazing ways.
We're talking like wait times, how accurate the triage is, patient outcomes, all that's tracked.
All that and more. It even gives reports on those key performance indicators, those KPIs.
Right.
Gives hospitals this valuable look into how their ER is doing.
So it's like taking the pulse of the ER.
Yeah. You got to understand its rhythm, then you can make it even stronger.
I like that. So how does all this data actually translate into better care, though?
Okay, so think of it this way. Hospitals can look at these trends, these patterns, and they can pinpoint where the bottlenecks are.
Okay.
See where things are getting jammed up.
Right.
And then they can make changes to boost efficiency and make care better overall.
Can you give me a solid example?
Of course. Let's say the data showing wait times are crazy long on Monday evenings.
Monday's always a struggle.
Right. So the hospital knows that. They adjust staffing, bring in more nurses, more doctors to handle it.
Smart.
Or imagine this. The data shows a ton of people coming in with the flu at a certain time of year.
Flu season, yeah.
The hospital can be proactive, set up a dedicated flu clinic, handle that volume, maybe even prevent it spreading as much.
It's like they're one step ahead.
Exactly. And it's not just reacting to what's already a problem, it's about always getting better. Hospitals can track if those new interventions are actually working. See how they measure up to national standards, even contribute to research.
So Bluebird's a tool for good, for making things better in emergency care.
Exactly.
Yeah.
But, at the end of the day, it's about the people walking through those doors.
The patients.
Yeah, 100%.
Let's talk about that human side of things. How does Bluebird actually impact the experience for a patient in the ER?
Put yourself in their shoes for a second, right? You're there, you're stressed, you're not sure what's going on.
Yeah.
With Bluebird, you're met with a system that's designed to get you the care you need, starting right when you walk in.
So that color-coded system we talked about, that's making sure the right people see you at the right time.
Exactly. And those assessments Bluebird helps with, those aren't just boxes to check. They make sure you're thoroughly evaluated.
Nothing's missed.
Right. And because Bluebird's all about clear communication, sharing that data between your providers, everyone's on the same page.
No miscommunication, no delays.
Yep. That peace of mind is huge when you're in the ER.
Definitely.
Oh, and don't forget the clinical decision support. Your doctor has all those latest guidelines, recommendations right at their fingertips.
So from check-in to discharge, Bluebird's working behind the scenes, making sure everything is as smooth and patient-focused as possible.
That's Bluebird, a major step forward for emergency medicine.
It's really amazing to see what we can do with tech like this now, but it also makes you wonder, where do we go from here? What's the future of the ER, really?
It's a good question. We're already seeing AI, artificial intelligence and machine learning popping up everywhere, healthcare too.
True.
I could see those being built into systems like Bluebird down the line seamlessly.
So, what would that look like? Paint me a picture.
Okay, so imagine AI algorithms, right?
Okay.
They've been trained on tons of patient data, and they're looking at the Bluebird data in real time.
Uh-huh.
They could pick up on these subtle patterns, risk factors, things that we might miss.
Like a second pair of eyes or an extra brain almost helping out.
Yeah, exactly. Like AI might be able to tell if a patient's at risk for sepsis even before there are any clear signs.
Wow.
Or it could look at past admissions, community health trends, and actually help predict those surges in ER visits, like during a bad flu season.
Yeah. So they'd be ready before it hits. It's kind of mind-blowing how that could change things for patients, make the ER even more efficient.
Yeah, the potential is huge. But, and this is important, with any powerful tech, we got to be smart about it. Make sure it's being used ethically, responsibly.
Oh, for sure. We can't just jump in without thinking about the consequences.
100%. But if we have these conversations, if we put ethics first, then we can use tools like Bluebird and AI to really transform emergency medicine for the better.
Absolutely. Well, that about wraps up our deep dive into Bluebird. Hopefully, you're leaving with a better understanding of how tech is shaping the future of healthcare, especially in a place as busy and sometimes unpredictable as the ER.
It's an exciting time.
It really is. From making things run smoother to giving healthcare providers the information they need right when they need it, Bluebird gives us a glimpse into what's possible. More efficient, more effective, and truly patient-centered care.